When we think about medicine, we usually picture a scientist in a lab, a miracle cure, a nice, neat, definitive answer. But what happens when there isn't one? When the hardest questions have nothing to do with the science and everything to do with the people involved? Well, that's exactly where we're going today, deep into the world of clinical ethics. Because in the real world of healthcare, the path forward is almost never a straight line. It's messy. It's filled with uncertainty, with conflicting values, and with these deeply personal choices that no textbook could ever prepare you for. And that, right there, is the absolute heart of clinical ethics. Think of it like a compass. It's for navigating these unbelievably complex moral mazes when the right answer is anything but obvious. And the stakes? Well, they couldn't be higher. All right, so let's dive in. And we're going to start at ground zero, the examination room. We're talking about that fundamental one-on-one relationship between a patient and the person they are trusting with their health. This is the classic fundamental tension at the heart of it all. On one side, you've got patient autonomy, which is really just the core idea of my life, my choice. It's your right to make decisions about your own body. But on the other side, you've got medical paternalism, the whole doctor knows best philosophy, where the provider feels a duty to do what's best for the patient. So what happens when those two ideas slam right into each other? And believe me, these big ideas aren't just abstract theories. They show up in very real, very difficult moments every single day. I mean, just imagine being a doctor who has to tell a patient they made a mistake, or making sure someone truly understands the risks of a major surgery, not just scribbling a signature on a form. What about respecting a patient's wish to stop treatment, even if you know it could prolong their life? These are not easy calls to make. And sometimes the ethics of care can be as subtle as these specific words a doctor chooses to use. The research on this is crystal clear. When a health professional uses dismissive or negative language, it can directly and negatively affect a patient's health. It completely breaks down trust. It changes how you even think about your own care. And that, right there, is a massive ethical failure. Okay, but here's the thing. That one-on-one relationship, it doesn't happen in a vacuum. Not even close. We need to zoom out a bit, because the entire healthcare system, with all of its pressures and all of its problems, is often right there in the room, too. I mean, this question is just brutal, and it became terrifyingly real for so many of us during the pandemic, didn't it? When resources are scarce, how do you possibly choose? Who gets the ventilator? Who gets the organ transplant? The experimental drug? This is where those personal, individual decisions get completely crushed by the immense weight of the system. And these pressures, they come from all over. On the technology side, you've got things like electronic health records that can actually get in the way of a real human connection. Institutionally, you might have a younger doctor who's afraid to speak up against a senior physician. And then there's the big one, societal pressures, like deep-seated biases or restrictive laws that can dictate what kind of care a person is even allowed to get. Now, this can lead to something called epistemic injustice, and it's a really powerful concept. It's a fancy term, but what it means is simple and devastating. It means that because of who you are, your race, your gender, a previous diagnosis, your own testimony about your own body can be ignored or disbelieved. Your voice is silenced. And that is a profound ethical breakdown. And all this pressure, it has a very real, very human cost for the people on the front lines. It leads to something called moral distress. And it's this soul-crushing feeling clinicians get when they know exactly what the right thing to do is, but the system, the rules, the lack of resources makes it impossible for them to do it. It is a direct cause of the burnout and injury we see across the healthcare workforce. So, faced with all of this complexity, all of this pressure, how does anyone find their way through? Well, the good news is they don't have to do it alone. There are tools and, more importantly, there are teams designed specifically to help. And one of the most important resources out there is the Clinical Ethics Committee. Basically, this is a dedicated group of people. We're talking doctors, nurses, social workers, sometimes lawyers, chaplains, even folks from the community. And their entire job is to act as guides for these incredibly tough situations. Now, it's really important to understand that their job isn't to come in and act like judges, issuing a verdict from on high. Not at all. They're more like moderators. They create a safe space for conversation. They listen to the patient, to the family, to the medical team. They help analyze the core ethical principles at play. They offer recommendations. And, crucially, they help build consensus and trust so that everyone can find the best path forward together. And on an individual level, for the clinicians themselves, the goal is to build something called moral resilience. And look, This isn't just about having thicker skin. It's about developing the inner capacity to face these challenges with integrity and courage. It's the ability to hit pause, to reflect on your core values, and to find a constructive way forward, even when the entire system is pushing you in a different direction. And what's really key is that this is a skill. It can be strengthened with practice, with mentorship, and with a supportive environment. Which, of course, brings us to our final thought. The ethical mazes we've talked about today, they're only going to get more complex. As technology just leaps forward with things like AI diagnostics and gene editing, that fundamental question, first, do no harm, is going to take on meanings we can barely even imagine right now. The choices are definitely not going to get any easier.